So let's talk about the hormones specifically. Like I said, this is my own sort of breakdown. I don't think you're going to find this in any book, but unless the ones I wrote, but it will. It sort of gives me an idea of which ones where I need to focus and maybe focus a little bit less. So this slide is very busy, but if you're going to prescribe hormones, if you want to know about hormones, you really need to know what it is. This is called the steroidogenic pathway, and this is how hormones are generated from scratch. And all of this activity takes place in the liver. And the most important thing to know is that all of the hormones, so here's testosterone, here are your estrogens, here's cortisol. If we had a 3D, thyroid would be sort of coming back at you at the screen. DHEA is a precursor, and as is pregnenolone. But all of it comes from, the stuff we demonize, as genius doctors told everybody not to eat fat in the 80s and 90s. And so what do you think? And remember, 60% of our brain is cholesterol, right? What do you think happened when we started giving you drugs to get the cholesterols down to zero? Yeah, which is basically what the cardiologists do. And to just take a guess, right? So anybody who's on one of these drugs, these statin drugs, pull out the package insert and look at the list of side effects. And if you know what to look for, what you'll recognize is that the list of side effects are basically all of the side effects or what happens when you have low hormone levels. So they'll have hot flashes, night sweats, brain fog. They won't tell you it's from low estrogen because we block the cholesterol, so you can't make the estrogen anymore. But they'll sort of just list the symptoms. And if you look at it, I mean, it's 3 pages long. So the statins actually work. There's a higher up pathway here, and they work up here. So it blocks all of this out. So we'll talk about the 7 major hormones. We'll talk about testosterone. So it's kind of the granddaddy of all. And the first thing you need to know is that this is truly an anti-aging substance. This is more than, at least in the US here, all you hear about is sex. It really is universal. And sex is really, I mean, it's a part of it, but it's really, you could skip over that part of it. And if you have a life without testosterone, you're really not feeling very well. It's an antidepressant. It's an anti-anxiety agent. It's useful for strength, energy, sense of well-being, mental clarity. It controls neuronal excitability. So it's a calming agent. It protects mitochondrial dysfunction. That's a big term. You've got people talking about that, Lisa? Mitochondrial dysfunction.
Yeah, everybody. Yep. The vices of everything.
It increases interleukin 10, which is a pro-inflammatory cytokine. Low testosterone, anxiety, depression, fatigue, suicide ideation. Patients that have had traumatic brain injuries, the first hormone that sort of dissipates is growth hormone, and the second is testosterone. All of these patients that have suicide ideation and even complete suicide have low testosterone levels, for their sort of age group. On the other hand, just as an aside, autistic children, especially boys, have very high testosterone levels for their age. They also have very high growth hormone levels, but low IGF-1, which is the usable portion. So they have this sort of empty-headed syndrome. So they have big heads, but there's nothing in them. And that's where a lot of the behavioral issues come from. So loss of muscle mass, loss of energy, loss of balance, mental fatigue, and of course, loss of libido. So there's all sorts of controversies. I mean, things do happen with testosterone. You will get an increase in red blood cell count. For men, you'll get an increase in prostate tissue. It was thought that for the longest time that testosterone caused prostate cancer. This came from a paper that was written by 2 urologists in 1941, and it's still taught today. It was done on 3 patients that had prostate cancer. They gave them testosterone. 1 got better, 1 got worse, and 1 stayed the same. So the conclusion was that 67%, 2/3 of the patients who get testosterone with prostate cancer get worse, and then they'll die. I mean, that's where it came from. And I have students with me. I mean, they're still taught that today. It was not looked at for 50 years. It was pretty much debunked in the 90s. And there's a new study just came out in the last less than 6 months ago. And we'll look at that at some point. We're still sort of digesting that. And again, it was a big hullabaloo about the study. And what did they use? They used synthetic testosterone. Again, they're not using the natural ones. So these are all the things that have sort of been associated with testosterone. And pretty much, you may get a little bit of prostatic hypertrophy. You will get increased red blood cell count, but it was thought that they conflicted that with polycythemia vera, which is a blood tumor, which is a genetic blood tumor. So you'll get an increase in red blood cell count. That's one of the reasons you get more energy, but you don't get an increase in white cells or in platelets. So you only need a blood count to take a look at that. So we had a lot of VA patients, the Veterans Administration patients here, and they'd go back, they'd get their blood done there, and they would see that the red blood count was high, and they'd get all excited about it. And their doctors there made them all go get bone marrows because they said they had this polycythemia vera. And I kept saying, I said, that's not what it is, but talk to the wall. I just made this as a sort of just a list here. All of the references are here if you want them. We do a whole lecture on just complications of testosterone, and we go into the literature. But these are the conclusions, and the numbers there at the end. The references are there, Lisa, if you want them, if your audience wants them.
Yeah.
High testosterone levels does not increase the risk of prostate cancer. Testosterone therapy doesn't increase the risk of prostate cancer. It doesn't increase the risk of progression in men. It doesn't cause or exacerbate metastatic prostate cancer. And testosterone therapy in metastatic disease does not cause rapid progression and death. Doesn't do anything. This is what to do. This is kind of a little bit technical. If you patients who have prostate cancer, and these are sort of the 4 remedies. X-ray therapy seems to have the lowest recurrence rate, and this is a way to deal with it. And this is more for your physicians about what to do. Also, erythrocytosis, which is increase in red blood cell count. So the conclusions here: high testosterone does not increase the risk of blood tumors, heart attacks, strokes, or blood clots. So that's testosterone. I don't know if anybody has any questions, or just keep going, and we'll handle it at the end.
Keep going. Yeah, we'll do it at the end.
Okay. And so again, estrogen, we pretty much went through this when we talked a little bit about polycystic ovaries. Estrogen has 400 functions that have been identified. It's probably the most studied molecule in the history of the world. The ones that we need to pay attention to are in blue here. So increased metabolic rate, increased insulin sensitivity. So it improves blood sugars. It increases blood flow to the brain. So early on, when we first started replacing testosterone in guys, we would give them enough testosterone to get their blood levels to 1,500. Normal, depending on what lab you're looking at, could be anywhere from 300 to 1,000, which is a ridiculous number anyway. But and then we'd see their estrogen levels go up, so we would give them estrogen blockers to get it to 0. Well, that was wrong, and that was wrong. Because you get to a point where you're only going to end up with side effects if the testosterone levels are too high, and estrogen drives blood flow to the brain. So these guys were falling over, they were forgetting things, they were putting their keys in the freezer, they were driving their car through the back of their garage into the kitchen. So we quickly realized that was not a way to go. So then we were partially blocking estrogens. Well, it turns out that what happens in men is the same thing that happens in women. With no estrogen or low estrogen, you end up with osteoporosis and heart disease. So now what we do is, if they have symptoms of high estrogen, I'll go through that in a second, then we'll bring it down somewhat. But otherwise, we just leave it alone. It will improve plaque in coronary arteries, and it maintains skin collagen. If you, I don't know if you have like nursing homes in where you are, but yep. By this time I should have been thrown in a nursing home. So especially women, if you go to the lunchroom there and you see them sitting there, the ones that are sitting up and they're playing mahjong and they have nice smooth skin, and they're going out, they're going fishing with their grandchildren. Those are the ones who had hormones. And the ones that are slumped over and they've had osteoporosis, fractures, and they can barely pick their head up, and their skin's all wrinkled and all, those are the ones who did not. And it's pretty stark.